Dr. Ashish Jha, director of the Harvard Global Health Institute, is joining us now. Dr. Jha, thank you so much for talking to us this morning. So we just heard there in Tom's piece that some of these churches, places of worship, are considered super spreader sites. As we head into the weekend, what do you want people to know if they're going to go to church, and should they be going?
Yes, good morning, and thank you for having me on. You know, what we know is that any indoor gathering of a large number of people is risky, especially if you're in a hotspot. And obviously in places where there's singing or chanting or other things where those can really spread the virus. And so I think if you're in most parts of the country right now, large gatherings indoors, including church services and other religious services, is really risky. And I understand it's deeply meaningful for many of us. But I think we have to be very careful right now and really try to avoid it if possible. Okay, we've got this warning also this morning from Dr. Fauci talking about these states with severe outbreaks, saying perhaps they should consider hitting the pause button. I'm wondering if once the cat is out of the bag, can we really do that now? Can we put the pause button on some of these states? I think Dr. Fauci is trying his best to be very diplomatic. In some places, I think things are getting so bad or are so bad, they may need to go back to a shelter-in-place order. I look at Arizona, the 50% restaurant occupancy. That's way too little too late at this point. I think the cat is out of the bag in many ways, and the states really have to ratchet back what kind of opening they've done.
So we're seeing around the country these long lines, people waiting in blistering heat to get tested. Sometimes the results of these tests are taking a week plus to get back to people. Is our testing system collapsing right now?
Yeah, you know, Cecilia, this is something that a lot of us have been talking about for months and saying that we really need a far more robust testing infrastructure. Dr. Fauci has said that. All of us in the public health world have been saying that. Unfortunately, our political leaders have not invested in that. And now we're seeing really substantial strains, and in some places really becoming, as you say, starting to collapse. And that's going to make fighting this virus much, much harder.
And what we're hearing from people on the front lines, again, is a shortage in PPEs, ICU bed shortages. It sounds like what we heard back in March. Can we handle the surge that we're facing?
Yeah, you know, it's one thing when it happened in March, when you could argue that we were unprepared, we didn't know it was going to be this bad. For this to be happening in July in states like Texas and Arizona and Florida, in my mind, is just unconscionable. We've got to protect our healthcare workers, and I can't believe we're going through this again. But we really do need to continue to push on ramping up, because otherwise it's going to be very, very difficult for the frontline workers to take care of people.
And finally, Dr. Jha, I want to ask you this. You've got health experts like Dr. Fauci saying pause. You've got political leaders like the president saying go. Who should people be listening to?
You know, this is a public health crisis. This is a medical crisis. And when you are sick or when you have a medical problem, you want to listen to your doctor and not your politician. And to me, this is pretty clear who people need to be listening to. Experts like Dr. Fauci, Dr. Birx, leaders in the CDC. Those are the people who need to be heard right now, not our political leaders.
Dr. Jha, as always, we appreciate your voice this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.